through direct infiltration into soft tissues, but invade the local vascular structures and then migrate distantly through the lymphatic or blood flow. So the lymphatic system is very much important, and the lymphatic anatomy is also very much important. The cancer cells can be carried in the blood to any corner of the body, but the lymphatic migration is usually stepwise through successive nodal stops, and this can temporarily delay further progression. So the rationale was based on the conventional chronological sequence that there is a primary tumor, and then the lymphatic channels are invaded, the lymph nodes are invaded, and then from there distant metastases occur. So this was the basis that for the treatment of the malignancies, that locoregional cancer can be cured before further spreading if the primary along with drainage nodes were irradiated and blocked, or the draining nodes were removed along with the primary. There were different kind of studies on the anatomy of the lymphatic system in the body, and the basic thing that they found is that the lymphatic system always shows, and it consists of two networks, the superficial one and the deep one, and they converge within each part of the body into deep lymph nodes area. And the superficial lymph vessels usually drain the skin and subcutaneous tissue, and they tend to run along the superficial veins. But the deep subfacial network they also course alongside the arteries and veins. The thing is that they needed to study to the functional pathways, the drainage pathways of these lymph nodes to understand the drainage of the lymph in order to proceed with the treatment, that is the removal of the possible metastatic channels along with the primary. The problem was that studies found that the lymph channels have the capability to grow again when there is a blockage somewhere. For example, they have the capacity for regeneration after obstruction or damage. So this was another consideration, another thing to be to think of, especially in the midline tumors, specifically in the structures lying in between the two mantle foramina, for example in the head and neck, and they can cross over and they can change their overall pathway of drainage. So generally the lymph nodes are filled with fat and center on large blood vessels, and then well circumscribed by specific muscular bellies and fascia. And they consist of numerous, as you can see, numerous vessels, interconnecting vessels. I'll show you in some other pictures also. Here you can appreciate the different connections between the lymph nodes. So, passing through successive group of lymph nodes, these ducts again divide into capillaries and finally give rise to large collecting vessels, which are usually 2 in number. The thoracic duct on the left side here, and the right lymphatic duct on this side. Both join the left and right brachiocephalic veins respectively. The lymphatic vessels are very thin, with clear colorless liquid, and usually are not visible in living tissue. So when they are studied, some dye, very opaque dyes, are injected. That's why we request CTs and MRIs with contrast to properly detect the lymph node involvement and see them. They are almost present everywhere, in every tissues of the human body, except some avascular structures like the epidermis, the cornea, and the cartilage, the brain, the spinal cord, and the bone marrow. So, as we study, the lymphatic system consists of 2 networks, the superficial and the deep, above and below the deep fascia. The superficial lymph vessels, as I told you, drain the skin and subcutaneous tissue and run along the superficial vein. And the deep subfacial network runs along the arteries and veins. They are connected to the nodes, unite to form deep main lymphatic channels, which are usually located at the outer surface of large veins. Okay, the first lymph node that drains certain area is called a sentinel lymph node. But the large number of interconnecting channels and the ability of regeneration of the after obstruction and damage display variable circulating relationships and relative independence from neighboring regions. Like, they are not wholly silly. Like, if a certain area, if certain tissues are drained by the submandibular lymph nodes, and if there is a obstruction or damage to the submandibular lymph nodes on that side, these lymphatic channels can regenerate, redirect their pathways into some other lymph nodes. So, like, the sentinel lymph nodes are important, but they are not the absolute pathways of draining a certain region. So, talking about the lymph node groups in the head and neck area, these are divided into superficial and the deep sarcophagia, deep lymph nodes. So the superficial lymphatics include the submental region. Here, this is the submental region. Then the submandibular region, and then the external jugular here, and the anterior jugular, the occipital behind, the mastoid, and the parotid. Let me show you. All of these them form a pericervical circle, as you can see, at C1 level. You can see this is the submental node. If you divide the area into circle, this is the outer circle, this is the inner circle, and the innermost. So the outer circle includes the submental node anteriorly. Going posteriorly, these are the submandibular lymph nodes, and these are parotid nodes, mastoid nodes, the occipital nodes, and coming again the mastoid, the parotid, submandibular, submental. So this kind of form a pericervical circle around the neck and the upper part. And these are all part of the superficial lymphatics, all of them. Other than these are two other lymph node groups that are included in superficial lymphatics. As I told you, they are the external jugular nodes here, above the sternocleidomastoid and below the platysma. They are quite superficial. And another one group is left. Here, these are the anterior superficial cervical nodes along the anterior jugular node, or also called the anterior jugular nodes. So these all are part of the superficial lymphatics: the submental, submandibular, the parotid, the mastoid, the occipital, the external jugular, and the anterior jugular. All of them are part of the superficial lymphatics. So if we go into details, the submental nodes are here, and they drain the skin of the, I told you the superficial lymphatics usually drain the skin and subcutaneous tissue, so they drain the skin of the chin, the skin and mucous membrane of the central portion of the lower lip and the jaw, and the floor of the mouth, the tip of the tongue. All of these superficial structures are drained by the submental. The submandibular node drain the skin and mucous membrane of the nose from here. This area, this includes submandibular nose. Okay. They drain the skin and mucous membrane of the nose, the medial portion of the eyelid here, and the upper lip here, the cheek, and the lateral part of the lower lip. The central wall is drained by the submandibular nodes, and the anterior third of the lateral border of the tongue. Then are the parotid group. The parotid group includes superficial and deep nodes. They are subdivided Let me show you. Okay, the parotid nodes are divided into 4 subgroups. Number 1 is the subcutaneous, also called as preauricular. Let me show you in another picture. Here you can appreciate the preauricular lymph nodes. They're quite just in front of the ear, and they drains the lymph from the frontal skin, the eyelids, the conjunctiva, into the intraparotid nodes. These are the superficial nodes of the parotid. And then the intraparotid nodes are further divided into superficial intraparotid and deep intraparotid. The superficial intraparotid are just beneath the parotid fascia on the external surface of the gland. If you look into this cross section here, these are the superficial intraparotid. This is the parotid gland at C1 level. Okay, so these are the superior intraparotid, superficial intraparotid nodes, and these are the deep. The deep intraparotid nodes are scattered, so you can see them here, here, here. And then there is another node called as the subparotid node here, below the parotid gland, inside, medial to the parotid gland, and it's located between the parotid gland and the pharynx. Here is the pharynx. So they are, as you can see, in close contact with the carotid sheath. This is the carotid sheath, the internal jugular vein, the carotid artery, and all of it. Okay, this is the digastric belly here, posterior belly. And then we have the retropharyngeal lymph nodes. They are also part of the pericervical nodes. So they are located here, a bit lateral in the posterior part of the pharynx. Posterior to the pharynx, posterolateral is and anterior to the longus capitis. This is the longus capitis muscle, prevertebral fascia, retropharyngeal node, and the pharynx line muscle constrictor. So then the mastoid here, these are the mastoid lymph nodes, very superficial, above the insertion of the sternocleidomastoid muscle in the retroauricular area, and they drain let me show you here. Okay, they lie superficially to the sternocleidomastoid, and they drain the temporal region of the hairy scalp and the posterior surface of the auricle and the posterior wall of external acoustic meatus. Then comes the occipital nodes. Occipital nodes lie near the lateral insertion of the trapezius muscle. They always occupy a subfacial plane and receive their efferent vessels from the posterior part of the hairy scalp, the posterior scalp. Okay, so these were some superficial lymphatics. Not some, all of them. here you can see in this diagram also the submandibular, parotid, mastoid, occipital form the pericervical chain, and then the external jugular, and then the anterior jugular lymph nodes. All of them are part of the superficial lymphatics. Then comes the deep lymphatic. The deep lymphatics drain the mucous membrane of the upper aerodigestive tract along the organs such as the thyroid, the larynx, into the deep cervical lymph nodes. Okay, the deep cervical lymph nodes include the internal jugular chain, the spinal accessory chain here. This is the internal jugular chain, this is the spinal accessory chain, this is the transverse cervical chain here, and this is the transcervical chain. The retropharyngeal chain that forms the part of the pericervical circle is also the part of the deep lymphatic basically, and the deep anterior lymphatic chains. Anterior deep, you can see they are labeled here. It's pretracheal and thyroid. Okay, so first of all we'll see the internal jugular chain. You can see the internal jugular chain here. These are all along the anterolateral aspect of the internal jugular vein here. Okay, so there are about 30 to 60 lymph nodes located around the internal jugular chain, and then there are some, most of them are on the anterolateral aspect, but there are some that are located on the dorsal aspect here. You can see them, they are called they are called the dorsal deep cervical chain, deep posterior cervical chain. So speaking of the deep lateral cervical chain that passes along the internal jugular vein, here is a picture. Let me show you. Here is another picture. These are the deep lymphatics of the neck. Number one is this. These are the internal jugular chain, the spinal accessory chain here, and the lateral posterior triangle. Here is the transverse cervical chain here along the posterior transverse cervical vessels, and the Delphian nodes and the pretracheal nodes and the paratracheal nodes. These all form the part of the deep lymphatics. Two nodes are very much important, and they are given a specific name. One of them is the jugulo-digastric. It is found here at the junction of where the posterior belly of digastric muscle crosses the, like, this is the posterior wing of the pharynx. So the posterior belly of digastric runs this way, and it crosses the internal jugular vein. Here is a node found called Kuttner's node. It drains the base of the tongue and the palatal tonsil. And another one is the jugular omohyoid, where it is present at the crossing of the omohyoid muscle with the internal jugular vein, and it receives lymph from the tongue and submental region. Just for practical purposes, the internal jugular chain is divided into the upper, middle, and lower parts, and the dividing lines are the jugulo-digastric and jugulo-omohyoid nodes. The jugulo-digastric node is also called as the Kuttner's node. Here, it lies at the junction of the posterior belly of digastric muscle, here, and the interjugular vein. It drains the nasopharynx, the palatal tonsil, and the root of the tongue. And here is the jugulo-omohyoid lymph node. It lies at the junction of the intermediate tendon of the omohyoid and the internal jugular vein, and drains the apex of the tongue all the way. You can see them again. This is jugulo-digastric, the Kuttner's node. This is the jugulo-omohyoid, the Poyer's node. So we'll be dividing them into the upper, middle, and lower parts, the internal jugular chain specifically, and the upper jugular nodes contains the lymph nodes that are located around the upper third of the internal jugular vein. This is the spinal accessory nerve, and wait. Here you may be able to see them. This is the spinal accessory nerve here, and this is the jugulo-digastric node. This is the digastric muscle, posterior belly, and this is the internal jugular vein. So where it crosses the internal jugular vein, here lies a node called the jugulo-digastric node or Kuttner's node, and it is considered as the here around this part are the other lymph nodes, and they are called as the upper third of the internal jugular vein nodes, and they are very much around the spinal accessory nerve. This is the spinal accessory nerve, and this is the upper one of the node of the upper third of internal jugular vein, and they goes from the skull base. They are I hope you can appreciate it. They they're way up here. This is the skull base. They are present at the level from skull base superiorly to the level here of the inferior border of the hyoid bone, or carotid bifurcation. Here is the carotid bifurcation. The posterior boundary is the posterior belly, posterior border of the sternocleidomastoid, and the anterior border boundary is the lateral border of stylohyoid muscle. So anteriorly is the lateral border of stylohyoid muscle. Here it goes like this. Stylohyoid muscle anteriorly, posteriorly the posterior border of sternocleidomastoid, superiorly skull base, inferiorly the lower border of the hyoid bone. This area is further divided by the spinal accessory nerve into two parts. One is called 2A and the other is called 2B. You can see here, this is the spinal accessory nerve, and this is the area where the upper the nodes and the upper third of the interjugular veins are present. So 2A nodes are anterior and medial to the spinal accessory nerve. This spinal accessory nerve here is considered as a vertical plane dividing this level 2. Basically it's called level 2. Is dividing this level 2 into 2A and 2B. So 2A is basically anteromedial to spinal accessory, and 2B is nodes are located posterolateral to the plane of the nerve, posterior and lateral. Got it? This is at level C1. So you can see them. This is a CD view. 2A are anteromedial to the spinal accessory nerve, and 2B posterolateral to the spinal accessory nerve. It kind of merges with level 5A posteriorly. So level 2A and level 2B divided by the spinal accessory nerve. Then the middle jugular nodes. The boundaries of the middle jugular nodes are around the middle third of the internal jugular vein, between the limits of the level 2, which was the inferior border along the level of inferior border of hyoid bone, and level 4. The posterior boundary is the posterior border of sternocleidomastoid. The anterior boundary is the lateral border of sternohyoid, starting from sternum, starting into the hyoid. So the lateral border of the sternohyoid makes the anterior boundary of this region, where the middle jugular nodes are present. And then is the level 4 nodes. The level 4 nodes are located along the lower third of the internal jugular node vein. The upper limit is the inferior border of cricoid cartilage, or where the superior belly of omohyoid muscle crosses the internal jugular vein. And the inferior boundary is the clavicle. Posterior boundaries are same. Anteriorly it's the hyoid muscle. Posteriorly, it's the posterior border of the sternocleidomastoid. The lymphatic internal jugular chain is here and the neck. Just to show you, they are lined just like this. The level 4 is starts below the inferior border of the cricoid cartilage up to the clavicle. The level 3 starts from the inferior border of hyoid bone up to the lower level of cricoid cartilage, and the level 2 is up to the inferior border of hyoid bone from the skull base divided by the spinal accessory nerve. Now comes the level 5. And the level 5 is also divided into 2 sub-levels. First of all, let's talk about its oral boundaries. Here you can see it's almost a pyramidal or triangular space. Its anterior border starts from posterior border of the sternocleidomastoid, and the posterior border is the anterior border of the trapezius muscle. Inferiorly is the clavicle, and superiorly is the area between the sternocleidomastoid insertion and the trapezius muscle. Okay, this is further divided into by horizontal plane. The level 2 was divided by vertical plane. This is divided by horizontal plane. At the inferior level of the cricoid cartilage, here is the cricoid cartilage. The level 5 is divided in this plane horizontally by horizontal plane. So level 5 includes the lymph node 5A, includes the lymph node along the lower half of spinal accessory nerve, and 5B includes the lymph from the transverse cervical chain. They are also called supraclavicular lymph nodes, by the way. So transverse cervical lymph nodes, lower half of the spinal accessory lymph nodes. The upper half were in a part of the level 2. And then comes the level 6 are anterior compartment lymph nodes, here anterior to the larynx and trachea, and the paratracheal nodes. The pleurolaryngeal are also called Delphian nodes, and the pretracheal and paratracheal nodes, perithyroidal nodes, all of them are included in the central compartment, deep central compartment, deep anterior cervical nodes. Remember that the superficial were along the anterior jugular nodes. They were superficial. These are deep. The boundaries of the deep are hyoid bone superiorly, here, the suprasternal notch here, and the common carotid arteries laterally on both sides. And then comes the level 7. They are the upper mediastinal lymph nodes, here, are shown here. So this division is of theoretical advantage as well as during practical approach, because they help us and stepwise when we are approaching the neck dissection stepwise. Next we'll be studying the triangles of the neck. Okay, so one thing more important is that these lymph nodes, as I told you yesterday, these lymph nodes, all of them, look at this network. The yellow one represent the superficial lymphatic channels and the green one represent the deep lymphatic chains. Not exactly, but here the green ones are the deep, the yellow, some of them are deep and some of them are superficial, but all of these nodes and the lymphatic channels, they are interconnected. If this is damaged or blocked, these lymph nodes can form another pathway and they can regenerate another pathway around it and then directly drain into these lymph nodes and or these lymph nodes without bothering this part. So this forms the basis of skip metastasis, and sometimes these lymph nodes higher up in the neck will directly drain into level 4 lymph nodes, as in the cases of tongue cancer, and they are called skip metastasis. So, and all of these lymph nodes are enclosed in these facial compartments that I talked about yesterday. The superficial are located below the subcutaneous tissue and along the superficial veins, and the deep are along the large vessels and deep vessels, and all of them are to be removed in functional neck dissection. All of them dissecting around these vessels, these arteries, these nerves, these muscles, these other visceral structures like pharynx, glands, parotid, and the body of the mandible bones, and everything. We are going around all these structures, preserving these structures. We are not bothering these structures in functional neck dissection, and we go for all of these lymph nodes. These lymph nodes are basically suspended in loose adipose tissues and these facial compartments. So we remove the walls of the facial compartment, these containers, along with these lymph nodes, and along with the primary. And when going for cancer treatment of the head and neck region. One more thing is usually they drain in a specific pathway. Here you can see the parotid drained into 2A. The facial regions or posterior facial regions and lateral are basically drained into submandibular level 1B. The anterior and middle areas are drained into submental, and from there they go into level 1B, and from there into the deep cervical chain of the internal jugular vein. You can see the 2A. The posterior, the mastoid region, superficial and deep both, drain into the level 3, and then from there into level 4. Usually, and similarly level 5 drains into level 5B and then into 4, and level 6 also drain into level 4 or directly into the major ducts, lymphatic ducts. Okay, speaking of ducts, there are two major draining ducts in the neck, on the right and the left. The left one is called thoracic duct, and the right one is called the right lymphatic duct. Okay, the thoracic duct starts here, cisterna cardi. Here it starts and runs along anterior to the vertebral column, and then it runs into the hair, and then on the medial aspect of the ascending aorta, and then descending aorta, and then goes behind the aorta and behind the subclavian artery, and then crosses it over anterior to the scalene muscle, and then drains into the junction between the internal jugular vein and the subclavian vein. It drains here. Similarly, the the right lymphatic duct also drains into the junction between the subclavian vein and the internal jugular vein. Here, this is the anterior scalene muscle. So this duct crosses this subclavian artery, like it comes from the posterior, around it, first posterior and then around it, and then comes to drain here in this region. And the pre-scalenic portion of the subclavian artery